Jordo. Okay. See how quickly we get to 50. Brian, I love you, but you were about 12th, not first. All right. We'll see how quickly we get to 100. Donna, wonderful. I'll think about the request later. Oh, yes. Okay, let's go. Okay, so last couple days, one of the major developments, the United States shot out to the lead. We are now number one. The United States now has 245,000 positive confirmed cases, positive infected cases of the COVID virus. That's more than double any other country at this point. Okay, so why does that look scary, but really isn't as scary as it may seem? I mean, the obvious answer is just right there in front of your eyes, is that is per capita. Obviously, you have to take population and population density into consideration. So, I mean, Italy with 115,000, and we have 7 times the population of them. You do the math there. But really, what is misleading about national numbers, and what I don't like about national numbers, and I think what's a really helpful way to think about the coronavirus in general, is that the news talks about nations. People talk about nations. A virus doesn't know what a nation state is. A virus does not know where a territorial boundary starts or stops, right? So a virus just sees a bunch of people together and attaches itself to those people. So it clusters. So that's what it all kind of stems from, this notion of being exponential in virality, that where it gets bad, it gets really bad. And where it doesn't get bad, it's not that much trouble. So if you look at the US, and you're looking at where was the growth, how did we get from 50,000 positive tests last week to 240 this week, and where did all that growth come from? Okay. Look at the state numbers. New York and New Jersey account for just about, at this point, what are we talking? That's 115. Yeah. At this point, the state of New York and the state of New Jersey, those two states alone account for about 45% of all positive infections in the United States. So clearly, there's been an outbreak, and New York is what they refer to as a hot zone. Okay, so that's a place that the virus has broken out and has spread, as many of the doomsday predictions and doomsday models would suggest. So if you're looking at the national numbers and you're thinking, oh my God, this is so terrible, the United States is just shooting past every other country, you got to remember, you take the other 48 states combined, essentially every state other than New York and New Jersey, and most of those are clustered around New York City, and we have relatively about the same amount of positive infections as Italy or Spain, with 6 to 7 times the population. So that's why I really don't like using national numbers. And those are really just scare tactics and just cheap, lazy reporting by the media, because it's easy to say, it's easy to get headlines and clickbait by saying, hey, the United States now is the country with the leading country with the most positive infections of the COVID virus on Earth right now. That's a headline that's going to get a lot of clicks, but it's very misleading because so much of the many of the infections are concentrated in New York and New Jersey. I mean, it's out of control. You saw those numbers. It's 115 out of 240,000. And you can kind of combine New Jersey and New York at this point because it's mostly in northern Jersey. Because northern Jersey is essentially a suburb and attached to New York City, because you have so many commuters coming back and forth in between New York and New Jersey. So you can kind of see that population density and all the people that are just passing by each other and touching the same objects constantly day to day. That's what really spread the virus in New York, and that has accounted for just a massive increase in the overall positive infections in the United States. That, like I said, you go extrapolate out the national number, taking out New York and New Jersey. New York and New Jersey, about 50 million people combined. So let's call it 200. That brings down the American population to about 300 million. So the other 300 million, the territories in the United States that account for the other 300 million citizens in our country are about the same as Italy right now, about 115,000 positive infections. And even those are super clustered. Let's start looking at the other states that are kind of having an outbreak, and we're kind of seeing why they had an outbreak, and we'll kind of trying to trace it back a little bit. Okay, so some weird stuff, right? Obviously, you've got California. That's its own topic. We're going to talk about it in a few minutes separately. Michigan, Louisiana, Florida, Massachusetts. Okay, going one by one. Michigan, and this is something I mentioned on my story the other day. So Michigan, you're wondering, out of all the places, Detroit, Michigan is one of the hot spots that really broke out. Detroit, as it turns out, is right in the line of fire for Asian travel. Delta, apparently, one of the hubs for direct flights from Asia on Delta Airlines is Detroit. So, once again, it doesn't take a rocket scientist to figure out, where the original outbreak, a random city that just happens to be, right in the crosshairs of all that travel and all those travelers from Asia coming in from China. And Detroit, you add to that, the population density there, and some of the hygiene issues. And I'm sure some of my friends here from Detroit and the surrounding areas have some thoughts there. But that's the explanation there on Detroit, pretty much. Louisiana, which is another one. If you're looking at trouble spots right now, Louisiana and New Orleans, it's troubling. It's troubling for sure. You're looking back at what happened in New Orleans over the past 6 to 8 weeks. You've got Mardi Gras. Once again, it's not complicated. Viruses do not know what cities are. They don't know what countries are. Viruses just know where a lot of people congregate together because it transfers person to person. And that's essentially how you can trace back to which spots get hit the hardest. So the general point here being, and Florida is another issue because they locked down late, as did Massachusetts. Those are two of the states that decided to hold off on their general stay-at-home orders and let their population and let their citizens continue to act as they continue with normal life, and that is turning out to be a really, really poor decision because it's led to some additional outbreaks in those territories. But the general point here being, don't look at national numbers. National numbers mean nothing. The United States is one of the largest by pure landmass countries in the world, 365 million people. You have to, if you're going to try to analyze what data means and what you're trying to learn from it, you've got to be able to look at it from these different angles. That, you can't judge the US the same way that you can judge Italy. Even when you're judging Italy, most of the infections are in northern Italy. You go down to Rome, there's not even much of a problem in Rome, right? Everyone's on lockdown, don't get me wrong, but the virus didn't break out in Rome. In Lombardy, in Brescia, in Milan, you've got bodies piling up in morgues and ICUs. You go down to Rome and things are pretty chill. So you got to understand, if you want to analyze this thing properly, you got to look for the concentrations in the hot zones. They don't necessarily extrapolate all the way across the rest of a territory. And that will bring us to our next topic here, which is California, which kind of funnels into the last topic we were discussing about, not necessarily looking at a national number and that not necessarily telling the story for all other territories. Okay, so I don't want to get ahead of myself. I think we can call this the "Let's not start sucking each other's dicks just yet" segment of the IG Live. But let's not start sucking each other's dicks quite yet. But California is looking really fucking good. There's just no denying it at this point. We're now about 17 days past lockdown. The total infections in California, 11,000. Which, if you're accounting for population density, if you're looking at that, California has 7 times as many residents as Michigan and only about 9 to 10% more total infections right now. California locked down early. Gavin Newsom. So to back up a second, California does have a really bad testing problem. So the problem, you cannot, up until very recently, maybe the last 5 to 6 days, it's been very difficult to get tested in California. There was just a supply line. There's centralization in trying to centralize the disbursement of the tests through the federal government, some other centralized repositories. California got shortchanged. Then you had some other issues with, some of the private testing facilities that really got stuff backed up. And so California has under-tested for a state of its size. California has given as many tests out as states that are a lot smaller than it. And okay, there was an article. So Alexis Madrigal is a writer for The Atlantic. Really smart dude. He is the one who started one of that COVID tracking state-by-state website that I've been referencing a lot that just tallies up the infections and the positive test rates for each state. And he's done a great job. And then they wrote this piece. Hold on. This piece is called, Okay, private labs are fueling a new coronavirus testing crisis. Okay, so this piece is all about how the state of California is not testing enough people. And the people that it is testing, the results of the test are taking way too long to come back. And this is confirmed. This is true. Even as of 2-3 days ago, California was maybe, if on March 29th, you were still waiting on test results from like March 19th. And that's terrible, obviously. However, just because you're not getting it, then of course the concern is, right, okay, California's numbers are low and it's misleading because we just didn't get the fucking test results back. And that's definitely like what your first instinct is, correct? And there's nothing wrong with that. However, it's not necessarily true because you can judge and you can analyze and you can come to conclusions about the state of California based on other evidence. Because once you get a certain point past the time that you lock down, even if you have all these undiscovered positive cases that haven't been tested, they start showing up in the hospital. So you don't just look at the number of positive tests and the number of deaths. You look at the ICU, the main number, and the number that Gavin Newsom and the state officials are really looking at right now is ICU occupancy. Okay, so it's how many people come into the ICUs that are in such bad shape from COVID that they have to get hooked up to ventilators and be in intensive care units and all of that. Because, and I hope you guys are following me here, regardless of whether you're getting test results and you're testing people properly, sometime around 12 to 15 or 12 to 16, 17 days after you've locked down, you can assume that all those people who got the disease before lockdown are now going to start materializing, and you're going to see that reflected in the hospitals. And the good thing is, and the reason that we should be very, we kind of need to be counting our lucky stars here in California is you're not seeing that. The hospitals are not overrun. The hospitals have capacity. As of yesterday, I believe California state capacity for ICUs is 4,000. Only 774 people were on ICUs as of yesterday. That's a ton of capacity. And you could say, well, we didn't test these people. We didn't get the test results back. We locked down 17 days ago, guys. If there were all these undiscovered cases of positive of infected people out there, that would start to be reflected in the ICU numbers, and it hasn't been so far. There's one guy that I follow who's fucking great. His name is Bob Wachter, Dr. Bob Wachter. This guy is the head of the UCSF, which is University College San Francisco hospital. And every time I check him out, he's saying his hospital has a lot of occupancy. He's not seeing a lot of patients. He's not seeing a lot of people come in with respiratory illnesses. And that's just a great sign, because you do not, all the other hot zones, the places that are hot zones, you're starting to see those signs. You're starting to see, you see it right now in New York, right? Hospitals are completely overrun. I mean, there's some hospitals in New York right now. If some parts of New York, if your appendix bursts right now and you go to the hospital to get treatment, a treatment that literally could have been done in 15 minutes to save your life, they might not be able to do that treatment on you because they might not have any doctors to do it, or hospital beds to do it, or ICU units to do it. They might tell you to go home and die. And that's a really scary thought. However, if you're not in a hot zone that doesn't shoot past, that doesn't break through the ceiling on medical capacity, you don't have to deal with these issues. And that's what California is looking like right now. Another thing, another piece of information I got from a super smart guy, I think I mentioned him before, Dave Blake Jr. He is the head of biometrics at the Georgia, I think it's the Georgia College of Medicine, but whatever. It's Johns Hopkins, Duke. He's a brilliant guy, and he says that you could pretty much tell if you analyze the data from Italy, from Spain, from Iran. We have countries that we can look at and see like, okay, what happened X amount of days after they went to lockdown? You can pretty much chart out that somewhere in between 24 to 31 days after you lock down is where you see the peak in cases, see the peak in hospitalizations, see the peak in ICU occupancy. And we're coming up on that date, guys, and we are California and Los Angeles are so far away from any sort of ceiling. I mean, it would really, this virus, this is what Dave Blake said to me. This virus would have to contradict every piece of information that we have gotten from any of those territories for it to now break out in California. So I think, California is looking pretty good for the moment. If we're going to talk LA specifically, 4,045, 78 deaths. And I don't have the tab up right now. Okay, so I don't have the tab up right now, but of the 78 deaths so far in Los Angeles County, the vast majority of those have been elderly people, people with pre-existing conditions. And so, listen, nobody, once again, always the caveat, nobody's going to celebrate 78 deaths, but all things considered, you got to be, it's way below what any worst case scenario or really scary set of doomsday figures was. And we're watching the ICU capacity, and we're going to watch these numbers, but as of the moment, it's looking pretty good. Going back to not wanting to paint too optimistic of a picture here, this is just phase one, and something that I'm going to be talking a lot more about. And I think you guys are definitely going to be really interested about is, what does it look like when we open back up? Because we can't just go like, oh, great, we missed the first round. The virus didn't break out in California and Los Angeles. And so we can just go back to business and everyone can live their lives as they wished before. No. Once we reopen the economy, the only way we can do it without the virus breaking out again is for a really fucking crazy regime of testing and as I've said before, a layer of medical services all across society, kind of like what South Korea has. And just before I start my chat with Dr. Eitches in a minute or two, I'll just give you a little idea of what that looks like. It's pretty much a matter of testing, tracing, isolation. So you test as many people as humanly possible. The people that you test who test positive, you then trace them. Some weird shit's going to happen, guys. You're going to have the government using your cell phone data to track who you were near within the 48 hours before you tested positive or before you started showing symptoms. That's actually a rule that the LA Department of Health laid down the other day. Is that now they're saying that if you test positive, anyone who you interacted with within 48 hours of you showing symptoms needs to go get tested. And so then, as long as you can isolate all the people who test positive and then track who they were around and then test all the people that were around them in the last 48 hours. Like, listen, you're not going to eradicate the disease, and it's going to be a very uncomfortable existence. It's going to be an uncomfortable existence because you're going to have to live like this, but that's how that's how we get back to life. That's how we get society going again. Because if we don't, all we're going to do is we're going to miss the first round. We're going to open society back up and we're going to have to go shut it down again in 3-4 months. We are creeping up on 8:20. Sari, if you're there, maybe I'll just get this puppy started right now. Let's see this. Oh, my close family friend and allergist to the stars, Dr. Sari Eitches, is in the comments giving some amazing information, I have no doubt, and I'm going to patch in his daughter. We are going to learn a lot. There she is.
Hello. Hi, Matt.
Hey there. Okay, so with us right now, a young lady that I have known literally since she was born. I think I pretty much did, probably like day 6 or 7 at latest. I mean, yes. Close family friends of mine, Dr. Sari Eitches. She is a board certified internist here in Los Angeles. Her husband is on staff at Cedars. She had the experience of getting the COVID virus early this year. She's also a mother of 2 young children, so she's obviously that will focus your attention, your efforts very quickly on a topic like this. So she's highly qualified to discuss this. Really looking forward to you telling us a little bit about your experience here, Sari. So why don't you, first just elaborate a little bit on the background that I gave about you, and then you can tell us about your experience having gotten the coronavirus, having survived it, and now in recovery.
Yeah, thank you so much. Okay, so I'm at about day 19 now, and I've had a good 4 days of feeling pretty much like myself. I still, volume's good, you're good?
Yeah, we're good.
Okay, sweet. So it's interesting how quickly things have changed, but in the beginning of March, I was absolutely following this closely. I trained in New York City, and so some of the internists I trained with had been texting me, be aware, this happened before you know it. And so it was on my radar. I made sure to follow all the guidelines that were available at the time, screening people before they came in, not seeing people with fever or cough. But now we know that those guidelines are so, they were like algorithmically outdated by the time I was probably exposed. And so now we know people can pass on the virus 48 hours before they even show symptoms. And we know the symptoms can look like a lot of different things, not just fever, not just cough. So in my case, I don't even know where I got it. I did see a lot of people with respiratory illnesses who were sick, whose flu test came back negative, who didn't fit the criteria for COVID testing back in February and March. And around March 13th is when I got sick myself. It started off actually just with GI symptoms, which are now well recognized, but back then were not.
What are GI symptoms?
Yeah, so diarrhea is the most common one, but also nausea and decreased appetite. And so in my case, it wasn't until about the third day I was sick, which was a Sunday night, that I got quite ill. Fever, chills, having like fever dreams, sweats. It was unlike anything I've had before. And so that morning it became very clear. I was already transitioning my practice to telehealth only, but that morning it became clear that I actually needed to isolate from even my family, and pretty much stayed in my room for most of the 2 weeks after that.
Okay, so I know this is a question that a lot of friends of mine who are young mothers and their friends that their wives are young mothers or young parents that are thinking about, if you get it and you're quarantined with your family, you do try to, thanks Dave, you do try to self-quarantine within the house and stay away from the rest of your family, to the extent to distance yourself from the rest of the family to a certain extent. But I mean, I imagine that's never going to be really perfect.
Yeah, I think it's a personal decision with each family. If there's someone in your home who's especially susceptible, like if you're living with older people or anyone who's immunocompromised in any way, then that becomes very important to isolate. But in our case, what was most important was that my husband stayed in a separate room. As you mentioned, he's a doc as well, so it would be an awful time to have two docs taken out. So it was important to have my own bathroom, my own room, and so we are fortunate to have the space to do that. Realistically, I did feel that by that time, probably everyone in my house was exposed. Fortunately, my husband never showed symptoms. My kids are preschool age. I mean, they always have a cold or something, so we won't know until hopefully we get to do antibody testing. But we did take all of that into consideration, and for whatever was reasonable, I did separate myself. And then when I did see the kids, I did a full shower in the surgical soap and put on new clothes and all of that. I wasn't coughing for most of it. The respiratory symptoms didn't really come for me until the second week.
And how bad were the rest? Because that's what you hear the horror stories about, are the respiratory conditions. So I mean, maybe if you could elaborate a little bit on that.
Yeah, I'm honestly, that was the most terrifying thing for me. It wasn't so much, I didn't have a cough so much, but it was like this chest tightness, like a burning, like you smoked a pack of cigarettes, and the next day it's just this, you're on fire. And that of course makes someone anxious, and then your heart rate goes up, and then you can't get a breath in, and you don't know. So I was really, like, my nightstand looked like a hospital bedside. I was taking my vitals, I was measuring my breaths, I was listening to my lungs, trying to do everything I could to keep myself home and make sure I was safe. But yeah, those respiratory symptoms are definitely different than anything I've ever experienced. I've experienced asthma in the past, and the tightness is really different. This is more of like a burning type of pain, like you're like really in a smoky, burning room.
And so I imagine there's a mental component to that, because it's anxiety inducing, because you've never, I mean, your lungs are all you got. Like those stop, and as we see with older people, you know, that's something even people that I hear that may have gotten it in New York that haven't, so few people can get tested, they can't sleep because they're scared to go to sleep. They're like, oh my God, I'm not going to wake up. And that's got to be pretty horrifying. Horrifying.
Oh, it's terrifying. Yeah. I mean, it's like, also, I feel like everyone's at a heightened anxiety level right now, and you just, so it all kind of, it can spiral, and it can be hard to tell what is coming first. And, you know, am I, you know, and the truth is like, yes, you know, there were nights where I was absolutely anxious and I absolutely was not breathing as I usually do. So.
No, definitely that's an interesting component of it. Everybody's a little more on edge these days, and everybody's, you know, we're in new territory. So you add that on top of it, and obviously thinking about your family and the cascading impact of anything that happens to you, and that's got to be really tough. So
absolutely
get it through. Okay, since everyone in the comments, and I know, you know, this is a popular topic, is viral load to mature human beings. All right, so one of the weird things that I think is throwing a lot of people off about the coronavirus is that there's such a divergence in the lived experience that you hear about. Some people say, I barely got it, I had a little fever, I had a few coughs, and I was fine in 6 days. And then you hear stories about people vomiting blood like the fucking Exorcist and dying on demand. And so what accounts for that? What's the distinguishing factor there? And from what I've heard, me as the layperson, that it's called viral load, that it's not just whether or not you get the virus, it's how you get it and how much of it you get. So if you get, first of all, you will get more of the virus that passes person to person as opposed to person from surface to person. If you get it from, and that how much of the virus you get is to a certain extent determinative of how serious your case is and what the symptoms are. And maybe we could discuss that a little bit.
Yeah, absolutely. That's definitely a topic that I've been following closely. For reasons that are kind of easier to understand, we know that older people and people with underlying conditions have more severe cases. But for reasons that we don't yet understand, and probably having to do with viral load, a lot of frontline health workers, nurses, and ER docs are getting quite ill. They're getting, you know, subtle symptoms and then really dropping. And those numbers aren't being tracked well in every state. California is doing a better job of it. But I am in contact with some of my friends in New York, and they have, you know, they're intubating their colleagues who are our age. Wow. Yes, it's awful. And so what can account for that? We only have theories right now. But from what I've read, what seems to be the most convincing is a combination of, yes, that viral load, multiple points of exposure. So if you're an ER doc in New York City, you have breathed in multiple different variations from all over the world of the coronavirus. And you're also, when you're that close to someone, and I'm just thinking back my own experience of, I was doing flu tests. I was really like up in people's faces and mouths in a way that feels like it was a lifetime ago.
Sure.
With what we know now. But imagine, you know, intubating someone and being really there for them. You're getting a lot more exposure, a lot more viral load that way. You're getting the multiple points of contact. And then my other concern is, you know, obviously people don't have the correct PPE. They're being told to reuse their PPE. These frontline workers, a lot of them have to turn in. A friend of mine told me that her hospital is giving her one N95 for the month, and it's being held at security. You have to check in and out to get it. One for the month. And she showed me a picture of it. It's like stapled together. It's not like a fancy reusable one.
We will get to this soon enough that I think the Kafka-esque nightmare of trying to get masks. I can get masks to people. No hospital seems to want them. It's out of control. The red tape and the administrative difficulties in trying to get supplies to people right now will literally. I've been batting my head against the wall. Me and some other very resourceful and connected people, and it just can't happen. It's a nightmare. So we will be discussing that as well.
Okay.
So, all right. So another piece of this and what I'd mentioned previously about, how we get out of this and how we get back to reality, well, not reality, but our new reality and back
Right.
to is we're going to have mass testing. Everyone's going to have to get tested. Tested. So maybe you can tell us a little bit, you plan on doing some of the testing. Maybe you can tell us a little bit about, where testing technology is right now, where you're anticipating it's going to be soon, and, what the status of that is right now. And Doug, yes, we're going to talk about the drugs in just a second.
Yeah, absolutely. So the testing, I totally agree with. That is our key to the next phase of this, where how long can the lockdown? I agree that, cautiously optimistic about the numbers we're seeing so far.
Yeah.
Really proud to be in California right now, where yes, we're the first ones to lock down. At the time there were rumors there was going to be a national lockdown, and I was all for it.
Yeah.
But anyway, here we are. So the nasal swab testing has a very, very high false negative rate, especially in people who are asymptomatic, minimally symptomatic. There's a very small window. You have to have a lot of, it is an actual respiratory sample. So you have to have a lot of respiratory symptoms, and it peaks at around day 4 of when you're sick. But now we know that maybe half of people have been exposed. I would guess my husband's been exposed and just never have symptoms. And it would be almost like a superpower to know that you have the antibodies. Then you could, you could conserve PPE. You can be the first people to re-enter the economy and that type of thing. And so the testing, I think, should pivot from that acute viral testing to more of antibody testing. And that technology is available. So that's...
Okay, so real interesting. So so why has the technology been so difficult to get here? And how accurate is that technology? Because I'm hearing a few people here and there mentioned that the antibodies, the self-test and the antibody test, and the ones, even though the jam the up the nose test isn't 100% accurate, it's more accurate than other tests. So what about accuracy, and what has been the friction in getting those tests here thus far?
Yeah, good questions. So yeah, the jam up the nose test, that is, the numbers look pretty bad, anywhere from 49 to 73% sensitivity. It has high specificity, meaning you're not getting a lot of false positives, but you are going to get a lot of false negatives. But the antibody testing is a blood test. And so it's looking, do you have antibodies? Has your body been exposed to this virus and you've made antibodies against it? The only downside of that is it does take some time to make antibodies, and there's 2 different ones that we're testing for. So the IgM we make more early on, probably during the acute infection, you'll find those. And then the IgG comes later on, maybe 2 weeks after you've been exposed. But that can last maybe a year. We don't know yet. This virus is so new, but based on other viruses, it can last maybe a year or maybe a lifetime. And that will give us some immunity. And so those are exactly what we need to test for. Just like you're talking about the bureaucratic slowing of getting the masks to the hospitals, the testing has been awful in the same way.
Unbelievable.
We had such a time lag benefit of when this hit us compared to what we were seeing unfold in Asia and Europe. And we didn't spend that time, unfortunately, mobilizing and being ready for this. And so I feel like we're kind of, running around with our heads cut off and trying to scramble for things. But that technology exists. It's in China. There are a lot of startups who are trying to license it and bring it here. There's some FDA approved one of the tests so far. And so hopefully there'll be more to come. And I do think that that's the future, our next phase.
Yeah. And that's, as I was mentioning I was given a lot of positive and optimistic information about California, and I stand by that information. However, I want to emphasize this is just phase 1. Phase 1 is make sure it doesn't break out. Phase 2 is, make sure the processes and systems are in place to keep us back at work once we do get back to work. And that testing is going to be critical to that. Okay, so why don't we go to, one, in terms of when you had the virus, a little bit of, how you treated yourself, how you advise others treat themselves, beyond just, hey, self-isolate and stay at home. What your doctor tips?
Yeah, good question. So I have between 15 and 20 patients right now who I'm treating who very likely have it. And I'm checking in with them daily until they start to get into recovery. And so it's been very interesting. I feel like I've been in a good position that I got it pretty early on and I can really understand and talk them through things. And so I feel like I have two roles. One is my public health role to really help them understand it, and it's easier today than it was 2 weeks ago, but to help them understand that, yes, that means you can't go get your prescription. You can't go to the, grocery store. Someone has to do that for you. And so that's kind of my public health point. And the other public health point is the testing. Like we said, it's just, there've been shortages. It's not very accurate. And it also won't change. If I have someone I'm highly suspicious they have COVID-19, and then I send them out to go get testing, then they are posing an exposure risk to other people, other people are exposing a risk to them. And then their test comes back negative. I'm not going to change any of my recommendations anyway, because I know how inaccurate the test is. And so I'm really at a point, it's frustrating, but I'm at a point where if it's not going to change our clinical management, I'm not even recommending the test. So my goal is really to keep people home out of the urgent cares and out of the ERs in a safe way where they know what that threshold is. And sometimes that's a phone call to me at 11 p.m. Like, and if I can hear them, I can hear their speech, I can hear their breathing and make a better assessment then. But for people who have milder cases who are recovering at home, I think having an awareness of the overlap between the anxiety symptoms and the COVID symptoms is really important.
Absolutely.
And then some really simple things like, steam is very relaxing for the lungs, taking a steamy shower, or even like putting a pot of water, taking it off the burner and just breathing that in. That's nice and relaxing. Doing some deep breathing to keep the lungs open. We do that in the hospital with this little machine, but it's easy to do yourself. And then people with underlying asthma, I've found inhalers to be helpful, especially anti-inflammatory inhalers, not so much the albuterol inhalers. Those can kind of increase the heart rate. Other things like kind of like these simple things, resting for sure. When we were talking earlier about why are young frontline workers dropping, I mean, I think it's because they're working through the early phases of their illness. Yeah. And that was, in my doctor, that was the first thing she told me was, you need someone to cover your patients this week. And I kind of felt like I've already moved to telehealth. My patients need me more than ever. It was a very hard thing to do, but I did. I had my friend Jeff Toll cover my patients for me, and that was
shout out to Jeff Toll.
Yes, my man. And that was so important for my recovery, to allow me to unplug and actually rest. And also, by the way, minimizing your news consumption as well, because
unless it's the Belinsky News Network, of course, BNN, the only place for honest, real deal.
Like,
exactly.
Yeah, absolutely.
This is the only place you come. Everywhere else is just a fucking anxiety button. It's a shot of, it's an anxiety IV. That's all that other stuff is. Awesome stuff. Okay, last question will be, and we will go to potential treatments and not vaccines because that's all complicated. But first of all, it's chloroquine and hydroxychloroquine. Are they the same? One, are they the same thing? Two, what are your thoughts on whether it's two items or one? And I'd love to hear your thoughts.
Yeah. So hydroxychloroquine, this is an anti-inflammatory medication. It's also an anti-malaria medication. And we use it all the time to treat lupus and some other autoimmune inflammatory diseases. The reason people got excited about it is that there was a test tube study, an in vitro study, where it showed it decreased virus replication of SARS-CoV-2. And
just real quick, is that internal replication? Because that seems to go back to the viral load. Which what I heard about the viral load issue is that the lower the initial viral load is, the quicker earlier your immune system will act on it to stop it from replicating within your body. Is that correct?
That's exactly correct. And that's actually how vaccines work. You give someone like tiny dose of, usually with vaccines, it's a killed virus. And then the immune system makes the antibodies and can keep everything in check before it gets a chance to overwhelm the system.
Sorry, Cooper Mount with Casa Azul might be the, anyways. Awesome stuff. And so chloroquine, these are still in their test phase. You've got some promising information about them. I mean, I'll get to this in a second. I don't know if you've heard about this. This doctor out of France who's become kind of a national celebrity in France. He's hyping chloroquine, says it's the magic potion. You've got more than a few of people in the French population who are like, why is not everybody taking this? And it's become almost a political and a public issue in France that the government will not adopt this as the solution, but this celebrity doctor is really pushing it, and that's been fascinating. I don't know if you caught wind of that. That's super interesting.
So, I mean, I feel like it would be so exciting if we had a medication that could treat this virus. We have to like really check what our biases are when we read studies like this. We want it so bad to be true.
Yeah.
But how many viruses do we have? Yes, a bacterial infection has an antibiotic that works very effectively. There are really no good examples of viruses that are super well treated, like chickenpox, flu.
Yeah.
Like we don't know how to treat these things well with antivirals. HIV people are on antivirals for life. And so I definitely am a little more cautious when reviewing that data. And also, if you look at the study, it's the studies themselves that these are based on, not that impressive, the results. I mean, exciting, yes, but the results themselves are not that impressive. The primary endpoint they're looking at is if someone goes from a positive to a negative nasal swab. We're not talking about fewer, if people are surviving, if they're getting off vents, etc. And the studies were not randomized. They didn't have a good control arm. It's probably unethical to do randomized control trial right now. But we do have to realize that these are observational studies, which at best can lead us to a hypothesis. Does hydroxychloroquine fight COVID-19? Let's design a study. But I think we're so far from that, as much as we really want to hold on to like, yes, we have the answer.
No, understood, and just plays into the many mass psychological issues that are at play right now.
Exactly.
And our judgment and the paths that we choose, both in terms of the treatment, in terms of the economy, can all be influenced by that. So it's really important to keep that in mind. Sari, have no words to tell you how great this was and how beneficial this was. We learned so much great information. Beyond that, I just wanted to say, and this is something that needs to be talked about more. This is a war, and our medical professionals are the frontline soldiers in this war. They're putting themselves in, between you and your husband, putting themselves, in some treacherous situations to keep, to allow us to get back to our realities in our life and to save people's lives. And the government's going to have to, we're all going to have to come together to find a way to repay you guys once this is all said and done. And, just wanted to thank you for your service and everything you've done, and for joining us here tonight.
Thank you. Thank you for having me and educating the people.
It's my pleasure.
All right.
Have a great night.
You too.
Bye. So, I mean, that was great. Wow. I mean, you hear so much garbage all over the place. You hear so much bad information. To be able to hear it from a professional who can explain it to you, in really humanistic terms. That was amazing. Okay, so that was super beneficial. Now we're going to do something also very beneficial. We're going to continue to notify you and alert everybody. Good to know that DJ Politics in the chat, he'll like this. We need to continue to alert people to the evil propagated by the Chinese government and the bootlickers who do their bidding. Today's bootlicker that we need to identify as someone who is a tool of the Chinese Communist Party. The World Health Organization. I'm sure a lot of you people think that the World Health Organization is a legitimate, benevolent organization that has everyone's best interest at heart. Unfortunately, that is not the case. The World Health Organization is deeply corrupt and is a tool of the Chinese Communist Party, and I'm really looking forward to showing you guys this. Okay. All right. First off here, World Health Organization drawing flack for the coronavirus. I mean, the WHO has connections to China all over the goddamn place. You already had
the head of the WHO, talking about how great a job China had done in controlling the virus and in espousing positive data, and they said that it was the model for handling the coronavirus worldwide. If the model is lying your fucking ass off, falsifying data, and putting essentially all of society at risk by your falsification of data, then yeah, I think they did a great job. But unfortunately, that's not an honest assessment. Okay, that is an assessment of their dishonesty, their gangster ways, and how China owes Italy about $100 billion a goddamn year every year for the next 200 years. Okay, absolutely disgusting what they did to what the impact that it has had on Italy. Beyond that, you had, where is this? Oh, this is fucking good. Oh, this is a fun one. The World Health Organization coming out against social distancing. No travel bans. Oh, you're racist if you haven't want a travel ban. Look at this fucking piece of shit right there. Look at that asshole from the World Health Organization. Yes, this disgusting individual, okay? These guys, the World Health Organization, the WHO is in China monitoring this situation. They had all this data. They were seeing the truth, okay? And they went along with the Chinese Communist Party's vicious lies. They did not do their job in alerting the world to what the reality of this virus, and they were essentially in the Chinese Communist Party's fucking pocket. Okay, and this is blatantly obvious to anyone who's paying attention. And if it's not blatantly obvious by now, oh, is it going to be blatantly obvious by the end of this? Well, I'll give you one more before the video that is just, it may make you vomit. Okay, and I've talked about this before. Okay, let's look at the WHO. World Health Organization Twitter account. That is January 14th, 2020. Okay, the World Health Organization, as late as January 14th, was propagating the Chinese government's story that there was no human-to-human transmission of the virus. Do you have any fucking idea how psychotic that is? Let's unpack this for a second, because I need you guys to understand what happened here. Okay, the World Health Organization, the world governing body for pandemics, for health, to protect us. Okay, it was boots on the ground, in contact with the Chinese government, Chinese Communist Party, all the way through December and January, seeing everything that happened in Wuhan, everything that happened in China. As of January 14th, this was not early. This was not at a period at which there was any plausible deniability for them to say that we just didn't know that it was we have plausible deniability that we did not necessarily know the nature of the virus. They were telling the world that there was no human-to-human transmission of the virus, meaning that you could not pass it from one human to the next. That is clearly a lie. The whole entire basis of the passing of the virus is human-to-human. Okay. And we're just going to let these people off the hook. They're clearly in the pocket of the Chinese Communist Party and the Chinese government. Like, how fucking blind must one be to look at this and not understand that? If you still can't understand that, this is going to be adorable for you. Okay, I don't know if everyone is familiar with the relationship between China and Taiwan. But essentially, it's a territorial dispute. China thinks that Taiwan is part of China, and Taiwan wants to be an independent nation. This is a big deal in China. This is a matter of a fundamental point of national pride that they have, that Taiwan be recognized as part of the Chinese mainland. Taiwan likes to refer to itself as an independent nation. If you refer to Taiwan, as opposed to referring to it as part of China, the Chinese government's not going to be too happy with you. Okay, so this is unbelievable.
Will the WHO?
So a representative of the World Health Organization is here getting interviewed by a Taiwanese journalist, and she mentions Taiwan by name, and look what happens. Hold on one second.
The WHO considered Taiwan's membership.
Look at this shit. Look at this.
I
couldn't hear your question.
Okay, yeah. Let me repeat the question.
No, that's okay. Let's move to another one then.
Right, because I'm actually curious on talking about Taiwan as well, on Taiwan's case.
We decided to give Dr. Alward another call to follow up.
And I just want to see if you can comment a bit on how Taiwan has done so far in terms of containing the virus.
Well, we've already talked about China, and you know, when you look across all the different areas of China, they've actually all done quite a good job. So with that, I'd like to thank you very much for inviting us to participate, and good luck as you go forward with the battle in Hong Kong.
Do you guys understand what happened right there? Did you guys see that? The leader of the World Health Organization was asked by a journalist to comment on the situation in Taiwan. He ignored the question and then pretended to hang up. Is that the behavior of an honest person? What does that tell you about his behavior? What does that suggest? Did you see him squirm like that? This is a person who is tasked with the health and well-being and the well-being of pretty much the entire world. And he can't be honest with a journalist like that because he can't mention that Taiwan is an independent nation. He has to kiss China's ass. That's insane. If you, after that, if you can still see that and not understand what's going on here, you are as blind as Ray fucking Charles, okay? Well, Ray Charles is blind, whatever. Clearly, the World Health Organization is in the pocket of the Chinese. They're telling people travel bans don't work as late as March. As late as March, China now has a travel ban. You can't travel to China now. If you don't live in China, if you're not a Chinese citizen, you cannot travel to China as of today. 3 weeks ago, the World Health Organization is saying, let Mother Nature take its course. Travel bans do not work. These are evil people. This is evil. You need to know who did this. You need to know that the pain, suffering, and death going on right now is traceable back to the Chinese government and their partners, the World Health Organization. Yes, you need to know this. You need to tell your friends. You need to stamp it on your forehead, and you can grab anyone who doesn't fucking get it and slap them across the fucking face. Backhand them. They need to know. They need to know that the lies and corruption of the Chinese government, the World Health Organization, are why we're stuck inside right now and why we've got every freaking person above age 65 right now scared for their life, okay? Every person who's dead is on their head. Don't forget this guy's fucking name. Don't forget it. Don't forget this guy right here. I'm not going to let you. Do not forget this piece of shit right here. Look at him. Look at him fucking squirm.
Hello?
Oh, yeah, you can't hear, you fucking piece of garbage.
Let me repeat the question.
No, that's okay. Let's move to another one then.
Right, because I'm actually curious on talking about Taiwan as well, on Taiwan's case.
Do you get it yet? Do your friends get it yet? Do they wake up? How much more is it going to take? Does the Chinese government have to come and blow your brains out for you to get that they're the enemy? Anyways. Yeah, I mean, if you haven't woken up by now, I don't know what to say. All right, Lauren, I apologize for the language, but you know how I get about China. All right, let's go to some comments for a second. Yeah, you should be angry. Do people not get it yet? How are you not angry? How the Chinese government has been fighting a one-way unilateral war against the United States for 25 years, and nobody knows, and like 90% of our country doesn't even acknowledge it. And you want to know why I know this? Because I was one of those people who was asleep for 20 of those years. I only woke up to this about 4 or 5 years ago. Okay? It's about time all the rest of you woke up and realized that there's one existential threat to American society, and that is the Chinese government. Period. If you don't get it by now, I don't know if you're ever going to get it. I hope so, Ollie. All right, let's see what's going on in the comments. Spencer, ask the question again, my friend. And my dad hopping in the comments to take credit for my hair. Yes. Yes. I ain't losing this puppy anytime soon. Shout out to Mike Belinsky, 73 years old, maybe 4 gray hairs. Really impressive. Brian, I'll get to total deaths in a second or two. L, shout out to you and your parents who are from Taiwan.
our thoughts and prayers are with the fine people of Taiwan in their battle for freedom and getting out of the thumb of the evil Chinese government. All right, what we're thinking about in terms of total deaths. Oh, dude, I got to get a phone doc. It's really strange. I will get a phone doc soon enough. But all right, deaths so far. 6,000 in the U.S. That's going to go up. That's definitely going to go up. I was getting a lot of flack a couple weeks ago because, listen, this is not a hoax. The coronavirus is not a hoax. This entire thing is not. However, the doomsday predictions were just not right. The doomsday predictions did not reflect. If you were tracking Italy like I was, and you were looking at what happens to a country and a territory after you lock down, basing it on what the numbers were at the time of lockdown, and then projecting it forward a couple weeks, you could come up with some fairly accurate assessments. Yes, Andy, a phone doc next week, or I got one coming sooner than next week. You can look. We're at 6,000 deaths right now. New York. I don't want to scare my New York friends. It's not going to be pretty for the next month or so in New York. However, you're seeing that New York right now is flattening out a little bit in daily new infections. It's still super dangerous because their hospital capacity is stretched. So I'm telling you, if you're a medical professional in New York or New Jersey right now, America's got to come together after this and give them all, a year's salary or 2 years' salary, because they're doing God's work right now. So New York is still super dangerous. The other hot zones, Detroit, Louisiana, Florida, we're not seeing where necessarily the hot zones are. We'll figure it out. Yes, the death rate is going to go up. Even California, the death numbers are going to go up a little bit, but I'm actually predicting not much at all, not significantly. And I hate to say this so cavalier, it sounds very cavalier, but if America by June saw more than 40 to 50,000 deaths, I would be pretty surprised. As long as we stay on lockdown, until we have the processes in place, and stay on the track, we're doing most territories are doing a good job. Georgia came around late, Florida came around late, Texas came around late, but Texas might have bought some time. I think they're coming around in time. I'm going lower barrier, 20,000, upper 50, maybe go 60 just to play it safe. But I think those are the numbers you're playing with, 20, 25 to 50, 60, which, listen, it's a fucking tragedy. It's horrendous. And don't forget who's responsible for it, the Chinese government. But all things considered, after looking at those worst case scenarios, after looking at the worst case scenarios, if we top out within that range, and we'll get to the orgy conversation in a second. We top out within that range, I think we got to count our lucky stars, as long as we handle phase 2 correctly. So that's what we're looking at there. Louisiana, yeah, I'm doing some more. Wait, I found a good chart on Louisiana. Where's the Louisiana chart? There's the Louisiana chart. Scott Gottlieb, definitely one of the guys you should be following right now. He put together one of the most comprehensive plans for how we're going to reopen society, and I will be summarizing it at some point. Yeah, there's Louisiana, man. It's going up there. Louisiana is dangerous right now. I also talked to a doctor at the Tulane College of Medicine. They're right in the thick of things, trying to get them some supplies. It's more difficult than you could ever imagine, but they're short on supplies, and they're dealing with a really difficult scenario. What are we? Oh, shit, we're almost coming up on an hour. Jesus, how time flies, people. All right, we got 2 more minutes. I just wanted to comment briefly on Adam Newman and WeWork, because this one was always a story I liked. SoftBank terminates its $3 billion tender offer. Bad news for Adam Newman, because that $3 million tender offer was going to put about $1 billion in his pocket. You're seeing there's some criminal charges now coming up, and I posted about this on my story earlier. It turns out that Newman is being investigated criminally. I believe it's Newman, but definitely WeWork in general, and it would by nature implicate him. Newman, there are some investigations going on both criminally and civilly, and those, I'm assuming SoftBank is going to use those investigations against Adam Newman to drive down the price of the tender offer and give him as little money as possible in the tender offer for his shares. We're coming up to the end of an hour. I think it's going to expire. So I just wanted to say want to thank everybody for participating, for Dr. Eitches again. I mean, invaluable information. Everyone for putting up with this vent. I will do something about that. I'll get like a background or some shit and a phone doc. And I'm going to have announce my next guest in my next live stream pretty soon. So look forward to chatting with you guys again.